Welcome to Sipher Health News. I'm Dr. Kritika Upadhyay, presenting you the latest health news. A phase 3 clinical trial published in the New England Journal of Medicine demonstrated an average of 14.9% decrease in body weight in adults with obesity or overweight who received an injectable diabetes medication named semaglutide, in addition to lifestyle interventions. Approximately 50% of the participants in the group achieved significant weight reduction of 15% and more, while 69% of the participants achieved 10% and 86% participants achieved 5% or more. The trial showed reduction in risk factor for diabetes and heart diseases and a greater self-reported physical functioning. As per the WHO, approximately 5.4 lakh deaths take place each year globally because of intake of industrially produced trans fatty acids. The WHO has called for the elimination of industrially produced trans fatty acid from the global food industry supply by 2023. The Food Safety and Standards Authority of India has amended its rule to put a cap on trans fatty acids in food products just a week after tightening the norms for oil and food. Food products in which edible oil and fats are used as an ingredient shall not be contained industrial trans fatty acid more than 2% by mass of the total oil and fat present in the product on and from 1st January 2022. NutriNet Center study is the first internet-based study of its kind, where data has been collected from 171,000 people aged 15 years and older, making it the largest ongoing nutrition study in the world. The data from the study have revealed association between diet high in ultra-powered processed food and increase the risk of cancer, cardiovascular diseases, mortality, depressive symptoms, type 2 diabetes, obesity, and gastrointestinal disorders. A study has also been published in British Medical Journal in 2018, which states that this large prospective study has showed results with 10% increase in the proportion of ultra-processed food in the diet was associated with a significant increase of decrease greater than 10% in risk of overall and breast cancer. In the wake of new strain of COVID-19 infection, the Civil Aviation Regulator, Directorate Journal of Civil Aviation, on earlier extended the suspension of all international flight operation in the country till 28 February 2021. To reduce the risk of importation of mutant strain of SARS-CoV-2, SOPs and international passengers arriving in India have been announced to upgrade themselves with the updated guidelines and new SOPs, which will be in effect from 22nd February. Pulmonary Arterial Hypertension Market Research Report, a global forecast by 2025, states that the online pharmacy is projected to witness the highest growth during the forecasted period based on the distribution, the pulmonary arterial market across the hospital pharmacy, online and retail pharmacy. India is third globally after the US and the UK in highest cumulative vaccination numbers, said the Union Health Ministry. Till 18th February, the cumulative vaccination coverage of health workers and frontline workers against COVID-19 in the country has crossed 94 lakh. The daily COVID-19 positivity rate has also been constantly declined in the last days, from 1.89% on February 1st to dropping to 1.69% on Thursday, which is 17th February, said by the ministry. The study published in the journal eLife indicates that combining cholesterol, lowering medication and lifestyle intervention may yield the greatest benefit to health, heart. Until now, no studies have been compared the lipid-lowering effect of cholesterol-lowering medication and healthy lifestyle intervention, said the lead author of the study from Harvard University. Also, the cholesterol-lowering medications such as statins help reduce health risk by lowering the levels of low-density lipoprotein cholesterol, also known as the bad cholesterol. The Union Cabinet on 17th February approved a slew of amendments to the Juvenile Justice Act 2015, empowering the district magistrate to issue adoption and orders as well as monitor the implementation of the law. The amendments are aimed at strengthening the child protection setup to ensure best interest of the children. These include empowering the district magistrate and the additional district magistrate to monitor the functioning of agencies responsible for the implementation of the Act. Thank you.
Hello all, welcome all of you to the Sipher Health News first episode. This is a very special episode because we will be conversing with Dr. Sonu Goyal, who is one of the youngest public health specialists from PGI Chandigarh. He is very passionate about his subject and also very popular with his students. Earlier, when we were medical students, the subject was called as social and preventive medicine, and now it is called public health or community medicine. Though our professor Dr. Harchan Singh, he was a very renowned person, a renowned public health specialist, but still we were not much interested. But when we joined PCMS, the Punjab Civil Medical Services as medical officer, then we came to know about the importance, and more so when we became medical administrator. So what is your say about this?
So first of all, thank you Dr. Gupta for inviting me for this Sipher news channel, and I think it's a laudable act that we are discussing about public health.
Yeah.
So when I just tell you my experience on public health, and then I'll tell you about what public health is. So when I joined public health as a medical student, so initially it was the same thoughts which you are telling. So we were told by my colleagues that public health is not a very fashionable subject.
Yeah.
So we don't have many people who are actually working on it. Mm-hmm. And then over a period of time, I realized the importance of public health.
Yeah.
So now I will tell you in the briefly about what public health is. So basically, public health is about preventing diseases, yeah, promoting our health, and prolonging life by the organized efforts of society. So it looks a very simple definition, but if you see prevention, prolonging and preventing the diseases, so I think it is a very holistic thing. When we are educating the community about certain diseases, when we are preventing illnesses and preventing people from coming to the hospitals, yeah, so that is the actual role of public health. If public health doesn't exist, then hospital will be full of patients. So that lies the importance of public health, that we prevent people to come to hospital, we help them in prolonging their diseases through appropriate lifestyle behaviors, and we help them in prolonging life. So in just public health is about preventing diseases, prolonging life and promoting health.
So basically you mean that it is prevention and promotion of health.
Yeah.
Right. And community medicine and public health, they are often used interchangeably. But is there any difference between the two, or are they interchangeable? And what is the difference between public health and clinical medicine?
Yeah, I think it's a very pertinent question, Dr. Gupta, and basically there are various school of thoughts of differences between public health and community medicine. And if you ask me what difference lies between these two, so I'll not go with the academic terms, but for me, both of them are similar. Similar in the sense they cater to the need of the population, they cater to preventing diseases, promoting lifestyle behaviors, and prolonging life. So the ultimate aim is the same. The only thing is the approach is different. Approach is little bit different in the terms that community medicine, we have the medicine into it, so it is more of curative things. Although in community medicine practitioner also practice public health, and in public health is more holistic. It may not be practiced only by the medical people, but also can be practiced by engineers, can be practiced by sanitary. So many professions can come, even lawyers can practice public health. So it is more holistic than the community medicine. The another question is about clinical medicine or clinical versus preventive and social medicine. Yeah. So as I told you that clinical medicine, the scope is limited to individuals. An individual come to hospital, we prescribe the treatment and he is treated, he or she is treated. In preventive medicine, we work on populations. We work on population's health. So holistic thing. It's not about individual. It talks about a broader thing of population. We prevent the diseases in the population. So it is more broader than a clinical medicine. But we can say that preventive medicine practitioner and the clinical medicine practitioner should work hand in hand to prevent disease and promote healthy lifestyles in the individual.
Right. So basically, public health people, they help clinicians also.
Yeah.
So in promotion of health. Right.
Exactly.
And public health has always been thought as a stream with limited scope and potential. So what is your say on this? Because now we see there are many hospitals who are employing public health specialists or people from from the
Right.
hospital administration background.
Right.
So what do you say now?
Right. So when when I joined public health in way back in 2002, so I was told that there are limited opportunity. Yes, there were limited opportunities at that point of time. Not many people are actually going into public health from our medical background, and everybody who is towards the last rank people normally go to public health. But yeah, these days I think it has become fascinating, and especially with occurrence of newer pandemics and newer diseases are coming. So then public health has become more fashionable. And now I can very well say many of my friends who are in pediatrics, who are in other professions are also joining also working as a public health practitioner. So they are joining Pulse Polio, this thing campaigns, and they are asking like how to join WHO, how to join UNICEF. So many people are now joining this. So public health, there is a lot of scope and potential. They can not only join the teaching line, where there are many medical colleges where now Masters of Public Health has been opened. So I think many dentists and many other professionals are joining Masters of Public Health, and they are very well settled. And now there is a big Bachelor of Public Health which is coming, and many other potential things which are coming. So this is about teaching. If you talk about research, so many research I think has been, they are going to the research field, and many companies are employing public health practitioner as a researcher.
Yeah.
And also the developmental agencies like WHO, World Health Organization, United Nations Children Fund like UNICEF, UNFPA, International Union Against TB and Lung Disease. Many organizations are now employing people who are from public health background. So there are now ample opportunities and scope for a public health practitioner to actually be being employed in a organization.
I agree actually. So I can quote my example as well, because I've been a clinician and ophthalmologist for 25 years.
Yeah.
Then I shifted to public health, and I found it very fascinating.
Yeah.
And for almost 10-11 years now I'm pursuing this as a profession also.
Right.
So Dr. Sonu, what will you talk about? Public health has always, you have a wide experience actually in public health, and especially in public health management. So what is your experience regarding this issue, particularly the management part of public health?
So when I joined public health, I was under the impression that it's a very smaller discipline. We don't have any super specialization into it, because in medicine and surgery, so all these subject has super specialization. They do DMs, but in community medicine we don't have these DMs. We have MD in community medicine or MD in public health. So when I joined this, and afterwards I came into PGI in 2005 as senior resident, and then in 2008 when the post came of health management, so they are recruiting faculty of health management. I joined that School of Health Management, School of Public Health, which is now Department of Community Medicine and School of Public Health. So I joined as a professor of health management, assistant professor of health management, and right now I am professor of health management. So health management, I consider it as a super specialty of the community medicine discipline, in which there are many other super specialization subjects like people practice epidemiology, some practice health promotion, some practices economics, nutrition, public health lab. So I joined public health management. So public health management is about planning, implementation, monitoring, and evaluation. These are the four pillars of public health management. So if you if we summarize public health management roles, so what we do is we help the governments in planning their annual plans, the PIP which they make, which they make. Also, we help other organizations in making their plans, and then in implementing the plan, how to properly implement the plan. And some governments also request us to do external evaluation.
Yeah.
So these are primarily the role of public health management person.
And you also plan about the national health programs.
Yeah, exactly. So I think that's a very good, that's a very good inputs to it. Like when we are implementing the public health programs, various public health programs, so then they call public health practitioners, especially those working in public health management, to actually plan their program and evaluate their programs.
Oh, yeah. So when I was in Punjab government, so we have been asking you to do that those evaluation studies, tobacco control program.
Right.
So it really sounds interesting. I just want to divert for a second and congratulate you for your excellent career. Really thank you for the amount of work you have done in organizing and building capacity of officials from various backgrounds, especially for the international public health management development programs you have been doing with Ministry of External Affairs. Please share some of the experiences you have with your students actually.
Yeah, so I think when I joined, I joined in 2008 as the faculty of health management. So I thought of building the career in health management, but not only building my own career, but expanding the horizon to the newer students or the potential students in community medicine in health management. So I thought of a program that is International Public Health Management Development Program. So we were doing, I was a teacher of Masters of Public Health. I teach MD Community Medicine, PhD in Community Medicine. So then I thought of expanding this teaching to the Indian audience. So I conceptualized this Public Health Management Development Program in 2016. So in that batch, I think we have many applications from different parts. I think we received from 28 states. The first program which we conducted, we received 200 plus applications, and it was a self-funded program. So it was a huge number. So we selected around 30 people, considering the fact that we have a good discussion and we hold that program. So one of the participants from there actually went to some other country, and there he met their ambassador. And he told that this program is very interesting and I want this country to actually adopt this program. Yeah. So their ambassador actually contacted Ministry of External Affairs, Government of India. And the Secretary, Ministry of External Affairs, Government of India, I got a call from his office that would you like to have this program for a flagship program for Ministry of External Affairs. So I gladly accepted that. So after two such programs which I conducted for our national audience, the third program which we conducted in 2017 was for international audience. So it was a flagship program of Ministry of External Affairs, Government of India, and we got applications, again numerous applications from 161 ITEC countries, and we selected again 35 odd applications despite mounting pressure that why not you select more. But considering that there is a proper interaction among the participants, so we took 35 participants and it was a very successful program. Then they asked us to conduct two programs in a series. We conducted that, and then they came to PGI, the Secretary and Joint Secretary came to PGI, and then they offered us to conduct a program on public health policy and management. So for very senior level administrators of these 161 ITEC countries. So there the expansion goes, and we are still conducting this International Public Health Management Development Program, and we have trained around 300 plus senior and mid-level administrators from around 60 plus countries right now.
And how many students were there?
So initially we have, it's a mix of group. We have teachers there from medical colleges. We have hospital administrators there. We have practitioners who are doing this thing in like medical officers, which we call there. Senior level medical officers are there, and some students. So we have a blend of stakeholders who actually attended. The USP of this program is the teaching approach. The teaching approach was a mixed method adult learning approach. We didn't use much of presentations and much of lecture work.
It was like a informal.
Yeah,
teaching.
it was more of informal teaching in terms of games, showing them videos, going outside for some case scenarios, and doing some informal games, even in Sector 17 Plaza or in Lake or in a rock garden. So I think we conducted a sort of a mixed teaching, formal as well as informal, which was really liked by the students and the senior level officers who came from here, and they recommended such programs to be conducted and more often.
Actually, I can vouch for the fact that it is very interesting and really very motivating also, because I have been an alumni of one of the courses.
Right. And you were among the first alumni. Yeah.
Because I was nominated by the government of Punjab.
Right.
So I learned a lot. In that course.
Right.
And
Just to add to it,
Yeah.
after this International Public Health Management by Ministry of External Affairs, recently we have been approached by the government of Odisha for an executive leadership program. So that we conducted with PGI in collaboration with Mahidol University in Thailand. So the students or the medical officers senior level who have done a good amount of tasks came here for 2 days, and we went to University of Mahidol in Thailand for 3 days. So it was a mixed teaching, and they really learned a lot. And now they have proposed us to conduct, government of Odisha has proposed us to conduct more such program, but due to COVID restrictions, actually we were limited to.
In fact, I think they were given certificates by the Mahidol University.
Yeah, it was a joint program given certificate by this very prestigious,
That is very prestigious.
public health university, and now we have memorandum of understanding and collaborations with many other partners now.
That's good. And I'd like to ask you, what is the role of public health in achieving SDGs?
Yeah, I think before SDGs, I will like to talk about like how public health has played a role in these COVID times. So I think public health role has been highlighted in this COVID era in the terms that like public health practitioners were involved right from the beginning. They were doing contact screening, they were doing awareness in the community about what COVID is, they were doing prevention, they were doing management of COVID, and also doing counseling of family members of those who are suffering from COVID.
In fact, all planning has been done by public health specialists.
Right.
And Government of India, it was good that they have been consulting public health specialists.
Right.
And India has been considered one of the best countries in managing COVID.
Right. And like you talk about the vaccines. So even in the vaccines, the planning of the vaccine, development of the vaccine, and then administration of the vaccine through the same route as being deployed by other vaccines. So it was very meticulously done, and development of vaccine took less than a year for development of vaccine. And now I think India is one of the countries where people from other countries are actually seeing this model and want to adopt this model.
Yeah, and recently one of the most developed countries, Canada. The PM has asked for medicines from our PM.
So
that is very interesting.
So every day, I think through this CoWIN app, this vaccine distribution and the vaccine administration is increasing day by day. And if you talk about a very pertinent question about how public health is helping our sustainable development goals. So I think
and moreover, how the stakeholders, they are being involved in SDGs.
Right. So we have the sustainable development goals which we have to achieve by 2030. So public health plays a very important role, because all these goals, although we consider only one goal that is related to health, goal number 3, which is related to health, but all the goal, whether it is reducing hunger, reducing poverty, water and sanitation, environment, everything is related to public health. So holistically, public health plays a very important part. And as we are moving towards the universal health coverage, that is providing equitable health to all citizens of country. So public health approach is the approach which brings equity. Like we are giving education to all people. We are giving treatment free of cost to all people, whether without differentiating caste, creed, or anything. So I think public health is such an approach which is required for attainment of sustainable development goals.
And surely, I mean, all stakeholders need to be involved.
Yeah, I think it is about what I used to practice since my joining is about involving people. So unless you involve people from different background, you develop a teamwork, you develop that leadership skill among people, we can't achieve our goals. So that leadership and like consultation of stakeholder, teamwork, and effective coordination among all the team members is really important for effective reaching of sustainable development.
And you are actually known for this. The coordination between all the stakeholders.
Thank you. Yeah.
And now I'll like to ask you about your personal life. So your wife, Dr. Sonika, your son, Pushp, and your beautiful pet, Dixie. So how do you manage all this? I mean,
Yeah.
in your busy schedule.
Yes, sometimes I feel that it is becoming difficult to manage the personal as well as professional life. But I try to do it by like not bringing much work to home. So when I go home, so I am normally greeted by my the pet Pixie. So she is really, I think she whatever the tiredness of the work which is there at my workplace. So when I take her into lab, so I think everything is gone.
Yes.
So all the stress are gone. And my wife, who herself is a dentist, and now she has done after dentistry, she has done Masters of Public Health, and then she joined PhD, and then she has done postdoc, and now she is employed in one of the universities in Ireland. So she's also practicing public health. So we used to discuss sometimes some of the topics which are interrelated to both of us. So I think we maintain that common harmony in exchanging our thoughts, which is very much related to each other. And my son, Pushp, I think he has been a great motivator, and I learned something from him too, like how to develop networking. So he developed that networking with his friends and how he talks, how he developed the network. So I learned some skill from him too.
Yeah, excellent. And just last question, because we have already taken a lot of time. So, what is your message for the young professionals who want to pursue this public health as a profession?
So I think I always say that we are sometimes very good at technical skills, but we do not possess much of leadership and management skills. So we should have that property or of skills of effective leadership and management. So that is the prime importance. So I always vouch for our young colleagues who join public health, a discipline which is no more a very boring subject. Now it's exciting subject. We have a lot of travels involved into it. You give talk at different forums. So I always talk about effective coordination. Develop your team who can do tasks for you, and with you work with your team. You do effective coordination among various stakeholders, and ultimately the main aim is leadership.
Yeah.
So develop that leadership competencies and empower them with those skills which you have attained, so that they take your name forward. So I think this is the only message which I give through our channel.
So thank you, Dr. Sonu. And I hope viewers, you have enjoyed the talk and got good insight into public health. And the young professionals who want to pursue the public health as a profession, they'll also benefit from this talk. So thank you all from Sipher Health News. Thank you.
Thank you very much. Thank you, Dr.
Hello and welcome to DocPlex's Health Minute. After initiating the vaccination drive for healthcare providers and frontline workers, the Union government has decided to begin the third phase of the vaccination drive for 27 crore Indians above 50 years of age 3 weeks from now. A renowned pharmaceutical giant has received the US FDA approval for its generic treprostinil injection to treat pulmonary arterial hypertension for the symptoms associated with exercise. Scientists from Regenstrief Institute and Indiana University School of Medicine have developed a short questionnaire that helps doctors assess the severity of symptoms in the patients and give optimum treatment to them. With the beginning of the year 2021, the world is recovering from the devastating effects of COVID-19 by gradually adapting to digital tools and innovations in the healthcare industry. Many such technologies and digital solutions have come in different formats and helped overcome the pandemic crisis. Digitization has united the world and strengthened the healthcare system. How has digitization helped to strengthen the healthcare system? Share your opinion by commenting below. Health Minute, the most liked segment of DocPlexus, brings you the latest happenings in the field of medical science. Stay tuned for more insights. Happy DocPlexing!